September is Neonatal Intensive Care Awareness Month, a month designed to highlight the nurses and doctors and also honor families experiencing a stay in the NICU. Joining the show now to speak about NICU Awareness Month is Dr. Jawad Javed. He is the medical director of the Neonatal Intensive Care Unit at OSF Children's Hospital of Illinois. Doctor, thank you so much for joining us this afternoon.
Oh, thank you for having me.
Well, first, before we chat about NICU Awareness Month, let's give a little background. How long have you been the medical director there at the Children's Hospital?
A little over 2 years now I've been the medical director. I've been in the Peoria area for over 10 years now, but here as the medical director the last 2.
I know I've covered a couple stories there at the NICU myself where we get to dress up the babies for the Halloween or
Yes.
With Thanksgiving. So I know you guys do a lot of amazing work there. So let's chat a little bit about babies born prematurely, right? They face numerous challenges. What are some of the battles and how important is it to celebrate those milestones even if they're little wins?
No, absolutely. I mean, you know, imagine when you're born prematurely, all your body systems are in an immature state. So they have challenges from the breathing aspect. They have challenges from the eating aspect and nutrition. Their immune systems are immature, and so infection is always a potential cause. And we try to celebrate these milestones with the families. For a lot of the families, this is not part of the planned experience of having a child in the NICU. And that chaos that ensues from that, you're trying to find some sense of normalcy for those families and try to bring that back into the things that they're supposed to celebrate. Coming to the hospital to have a baby is one of the few times you come to the hospital, and it's supposed to be a happy occasion. And so we try to really honor the families and try to get the bonding to happen sooner, celebrate those milestones after they make their first week, their first month, they come off the ventilator, they start their first bottle. Those are huge moments in each of these child's lives. And we try to celebrate and be really integral part with them so that they can have some sort of normal experience.
And what services are offered for families who do have a child within the NICU?
You know, we are so blessed here in Central Illinois to have such a tremendous children's hospital. We have over 140 pediatric subspecialists, 40 different specialties. So from the medical side, we are able to provide comprehensive pediatric services for our smallest of infants, from cardiology, cardiac surgery, general surgery, and then all the other subspecialties, infectious disease, pulmonology, endocrinology. We rarely have to send our infants away to get cares and services provided to them. In addition to that, to the families, we have a family support group. We have a great mentoring system that allows families to bond and partner up with parents that might have had children with similar diagnoses, and really to allow them to build on their support. Our family advisory group has done a tremendous job in providing meals, regularly with the families and allow them to share their experiences in the NICU and really help them along their journey.
And as I understand it, for the past few weeks, the NICU has actually been a part of a nationwide readathon. So how does reading really help with development, and how does it also help parents as well?
Well, this has been an amazing program. It's a program that has been started through the Vermont Oxford Network. We're one of about 50 hospitals around the country that has been participating with the Babies with Books program. And we've been requesting donations of new books to our NICU to help with our babies and to give them and provide. As I mentioned, you know, when the babies are born, and as part of that experience, we're trying to bring chaos to organized helpfulness, and really to help build the mom-baby or dad-baby bond. We do it through getting them to do kangaroo care early on and allow them to have that skin-to-skin contact. But the babies know the parents' voices better than anybody else's. And what better way than for them to read to their child, hear their voice? It helps in the neurodevelopmental aspects of creating those connections with the neurons. It really kind of helps solidify that bond, and it gives some sense of normalcy for parents that really are craving that to be in an environment where they can kind of bond with their baby. And so it has been a tremendous program. We had a great outpouring. Several hundred books have been donated to us. We are so blessed for all the people that have kind of contributed to this project. And I'm hoping that we continue to be able to provide books for every child that comes through our NICU. They'll get a book to commemorate their time with us during their stay.
And doctor, before we let you go here, if people have books at home that they want to donate, since we're talking about it, how can they bring that by or drop those off?
Sure. So because of the infectious issues that are ongoing, and especially with COVID going on, we can only take brand new books if they want to donate to the NICU. If you come to the front desk at the Children's Hospital and give it to the concierge there, they'll get it to us, and we'll be able to put those aside. So, and we thank you for that.
Dr. Javed, thank you so much for joining us right here on CI Newsday this afternoon. Great information. We are happy to have you here.
Thank you so much. Thank you. Support the Small Wonders Walk, and thank you for everything.
Wonderful, wonderful. Well, for more on this interview, more information on the Readathon, how to donate a book of your choice that's freshly bought, head on over to our website, ciproud.com. CI Newsday. We'll be right back.